Hi, my name is Adara Sos. I'm a student nurse at Cedar Crest College, and I produced my poster on infection rates and catheterization regarding intermittent and indwelling catheterization. So I was led to this topic because of where I work in an ER, and we see a lot of patients that come in with indwelling catheters for long-term care from long-term care facilities. And often they have UTIs related to these catheters, so I was curious as to if these could be prevented if intermittent catheterization was implemented instead of indwelling. So I created my PICO question based on this, and my PICO question is, in patients in need of catheterization, does intermittent compared to indwelling catheterization reduce the risk of infection? So this is significant to nursing practice because catheters are very common in the nursing world, and they are often used to either catch a urine sample or to relieve urinary stasis or urinary retention, but they are also associated greatly with a high risk of urinary tract infections. And obviously sepsis is a huge health problem that could be created from these UTIs. So in trying to find my studies for this poster, I searched two different databases. I used CINAHL and Google Scholar, and my keywords were urinary catheters, intermittent catheterization, intermittent urinary catheters, and CAUTI, which is catheter-associated urinary tract infections. So I found a large number of studies, but I narrowed them down using the Johns Hopkins scale for quality and the Melnick scale for strength. And so that led me to my first article, which is Gerard et al. And this was a prospective cohort study which they hypothesized that infections are more common with intermittent catheterization versus indwelling. So they implemented an education program to all of the healthcare staff in a hospital, in several different hospitals. And their results of this study, they found that infection rates were actually the same after their implementation of their education program, which is very interesting because you would think that the staff would already be educated on this and that wouldn't be the issue. So my second study was produced by Nyman et al., and this was a randomized control trial. Their purpose was to investigate the differences between the two methods of catheterization in relation to UTIs. So their results found that there was no significant difference in the rates of urinary tract infections between the two methods. My third study was conducted by Zhang et al., and their study was a meta-analysis of 9 randomized control trials. Their purpose was to compare the rates of UTI after either method of catheterization on surgical patients after a total hip replacement. So their results found that intermittent catheterization reduced the risk of UTI due to post-operative urinary retention. However, indwelling catheterization was more effective at reducing post-operative urinary retention. This is a huge risk factor for UTIs, so this is often why catheters are implemented after a surgery. But however, it was also significant that neither method was related to a greater risk than the other of urinary tract infections. So recommendations based on all 3 of these studies are to include training and education of the healthcare team on the process of catheterization, on sterile technique, which is often used or should be used during catheterization. They should also be educated on effective communication and documentation about existing UTI cases. It's also important to evaluate patients' experiences related to catheterizations in their past and determine their ability to avoid independently so that maybe some catheters could be avoided. And they also recommended that even though there's not a greater risk with either method, that they should still avoid unnecessary catheterizations because of the risk that still exists. So in conclusion, there was no difference between the two methods, unlike what I thought I would find. So both methods were found to have the same rate of UTI, and education should focus mainly on the staff, and it's not strictly related to the individual methods themselves. So I hope that this study and my presentation helps you in your practice. Thank you.